Dr. Martin Braun, our guest. He is a cosmetic physician, works out of the Vancouver Laser and Skincare Center. What about bags under the eyes? And those can happen when a man is young.
Yes, and I had bad bags under my eyes. I actually saw a plastic surgeon at age 47 because I was questioning about removing them. The problem with it's called the inferior orbital fat bag, these bags under the eyes, is that if you were to remove them, your skin is tighter, you briefly look better, but you start running the risk of looking very hollow-eyed. We get more hollow-eyed as we age here in any case. And I was told by the plastic surgeon, I actually got even another opinion, they both told me the same thing, do not take the bags out from under your eyes, simply use fillers. Yeah, the way my maxilla is shaped, I wouldn't get a great result anyway. You have to be very careful with cosmetic surgery with men, because often you can look a little weird. To quote Simon Cowell recently when he was on an interview,
Right.
you know, with the injectables, they're all reversible. So I am filled here, and by filling my cheek, which had gone down anyway, I have better anterior cheek projection,
Right.
but I'm now supporting this inferior eye bag. We have to ask ourselves, why do the bags slide out? Because we lose the support right here in the mid cheek. And by putting filler in here, I'm holding my eye bags up. And now my cheek comes out in the same plane as the eye bag, so they're less noticeable.
Right, and what about upper?
Okay, now for
hooded
the
eyes.
uppers, it's actually a no-brainer. Surgery is the best. One simply trims the curtain a little bit, 1 or 2 millimeters, and your eyes are more wide open and sexy. That's easy to do.
I like that. I
Yes.
need my curtains trimmed.
Yeah, that's simple. It's the lower lids that are more controversial, what to do. If you went to a plastic surgery conference, you'd see them debating what the best method is.
And what about those double chins?
That's another difficult one. The double chin area here, if it's due to excessive fat, we often will do the French mesotherapy, where we inject soy lecithin in this area
Really,
to
like
dissolve
meso
the fat.
soup?
Yes, and we have skin tightening lasers as well.
Right.
They're known as Thermage, Accent, Palave are some of the names. Thermogen is another one. So there's several of them that one can use to attempt to tighten the skin.
And do they work very
Not
well?
as well as surgery.
Right.
It depends how much skin tightening you get, how much your collagen is capable of contracting. Some people get fabulous results, others get very poor results.
Well, somehow it makes sense to me. If your skin looks vibrant and healthy, and then you have some surgery, if you're into that,
Yes,
it's better.
yes, that's
Wouldn't it
the
be?
logical
So
way.
if you keep your skin really healthy and moist and
Yes.
vibrant and all of that, and then somebody takes a little tuck,
Yes, you'll get far better surgical results.
I would think.
And many people, the old paradigm of thinking was you do nothing and then you just show up at the surgeon's office
Right.
one day, get upper lids, lower lids, and the facelift done. But the problem is, if you have deep wrinkles, large pores, broken capillaries, brown spots, the surgeon is simply moving those spots 1 centimeter closer to your ear, and you don't look right.
under your hair in my
Yes,
case.
exactly.
Yes.
And for men, it's very difficult because we don't have the long hair to hide the scars.
Okay, let's take a look at, is
Yes.
that Bruce Jenner?
Yeah,
Who's that?
I know it's hard to recognize Bruce
Yeah.
Jenner. I mean, there he
No
was. I
kidding.
mean, the Olympic champion. He looked fabulous in all the cereal boxes, and now he's had some surgery, and you have to admit he looks strange.
Right.
And there's the poster boy of poor male, cosmetic
Yeah.
surgery, Mickey Rourke. Again, it was a handsome man, and I mean, this is the problem with surgery.
Yes, and that happens to women too. We see
Yes,
it all the
yeah.
time.
And Kenny
And
Rogers.
Kenny Rogers,
as
who's
well.
a handsome guy,
Yes.
rugged guy, and
Yes.
look at what happened to him.
And I read he actually admitted that he was basically addicted to cosmetic surgery. He did 19 procedures over a period of time.
And once you do that, it must be difficult to go back. No
Yes.
matter if somebody comes to you and says,
Yes.
tiny error, can you give me a fill or a
Yes. It's
Botox
very
or a
difficult.
Restylane or
it's
a
very
something?
difficult. And so what I tell people is by taking care of your skin, you hit it right on the nose. If you want to have surgery, you'll have better results. And almost all the things we do are not addressed by surgery. Botox helps the stressful lines here. Like
Right.
many men don't want to look angry. I have some of the least vain men in the world come see me who are in middle management, and they don't want these deep number 11 creases there because
Right.
people come up to them and say, Charlie, what's the matter? And he says, nothing's the matter. They go, well, you looks like something's the matter because you have this stressed look on your face. And so they like to, diminish that.
Right. And so once you put a filler in there and somebody tries to make those lines again, I guess you can't because it's pretty well.
Exactly. So we use
you're
Botox and
stuck.
fillers. Yes. And my regular patients only have to come in twice a year. It's like a semi-annual injection schedule. They look very good because they've been taking care of their skin over a period of time.
Someone told me, and I don't know if he was joking, that if you go to Palm Springs, they have like a sign on the window that says Botox, $8 a needle, or
Yes,
something
yes,
like that. Now
yes.
that would scare me.
Yes.
Just
and
walk in off the street and let somebody fool with your
Yeah.
face.
Palm Springs is sort of the epicenter of very aggressive procedures, especially, I mean, some of the women down there. It really does not look natural. They have those ashen white faces. They look like a mannequin. They've been pulled too tight, and they've been lasered once too often,
Yes.
and too much filler. Like even in the lips, we all see it. The one syringe too many club, I call it.
One syringe too many. And a friend of mine said you could land a 747 on her lips.
Yes, oh yes, that's true.
And do men want their lips enhanced very often?
Not as often as the women, but I, for example, have done mine because they disappeared, and I'm going to do them again. I have no lower lip, if you look right
But you
here.
didn't do too much.
No, very little. Yeah, no. People look and they go, "Oh, you had your lips done." In fact, every square inch of my face has been
Right.
injected.
So do we have a before and after of you?
No, not. I should have brought one. Actually,
Should have brought one.
Well, actually, we do. I think in
We
my
do?
lower face, we have some of there.
Oh,
That
okay.
ugly mug. That's me. And so the top picture is my turned down mouth before, and there I am afterwards. And you can see the subtle enhancement that the lines here from the corner of the mouth
Sure.
are a little better, and my nasolabials, and I have a little more fullness.
Right, and see, you as a doctor notice that.
Yes.
I might look at you and not know what's wrong, but a downturned mouth, women have them,
Yes.
men have them,
Yes.
and you always look a little sad.
Yes.
And you're not sad, and you're right.
Yes.
People say, "Are you okay?"
Yes.
You go, "Yeah, my mouth turns
Yes.
down." Born that way.
Yes, we all lose volume right here in the corner of the mouth. Everybody does, right here. It's just a
do,
matter of time. And so there's two things we can do, put some filler there and a little bit of Botox here in the corner because
Right.
you have a muscle that pulls it down. Why help
Okay.
gravity?
Exactly.
Yes.
Well, every time you hear, I always want to do this, and I'm
Yes,
doing this,
yes.
and what woman doesn't meet her girlfriend and go, "What do you think?"
Yes,
Look,
exactly.
You know, the other parts of the body, say, little belly,
Yes.
love handles.
Well, something that we're really excited about now because it works pretty much consistently in anybody is called Cool Sculpting by Zeltique. And Cool Sculpting has been in Canada now for 1 year, and we have a before and after. The left there, the love handles were treated and the belly. And this is a fellow in his early 50s who's very active, plays hockey, golf,
Right.
gets out a lot. And you can see there he just wanted a straighter belly, and it's hard to get rid of that little pocket in the back. That's only one treatment.
Really?
Yeah, we hook
and
you up
you
to the
suck
machine.
it out? What happens?
No, we just, the machine is like a little suction device. You grab that little piece of fat, you freeze it, it sucks in the machine and is frozen for 1 hour. And the machine
So you're
doesn't
standing
freeze the
there for
skin.
an hour
No, you
while-
lay down. You can
Oh,
sit
good.
and play
I
on
like
an
that.
iPad. Yeah, it's very nice. And so
Doesn't
then
hurt.
for the first
Little bit.
couple minutes as it's sucking your skin in, that's a weird feeling because nobody has
Right.
grabbed that little piece of fat and frozen it. Once it's cold, after about 3 to 5 minutes, there is no longer any pain.
Really? And you know, we
Yes.
females have had mammograms, so we kind of know
Yes,
about
yeah.
squeezing and poking. So you take it in, you freeze it, and then
Yes.
what happens in the body? What does
Okay.
the brain
well,
say?
The fat cells have actually been crystallized and they're destroyed. And so the cell membrane ruptures, the fat is released because this was fat you couldn't access. If running around Stanley Park once would get rid of it, that's what you would do.
Sure.
People could just stop eating for a day, they'd lose a pound, but the love handle is still there because they don't lose it in that particular
Sure,
area.
or for women, we call it the muffin top.
Yes.
You exercise every day, you do
Yes.
Pilates, you do yoga, you
Yes.
eat right, everything, and you have just that little bulge.
Yes, and so this procedure is perfect for them because there's no needles, there's no downtime. You might have a bruise or some numbness or
Right.
tingling. That'll all go away because nobody has disturbed any of the nerves or vessels.
Okay, and does that fat come back?
Not only if you continue to eat too much, you see, because there is still fat remaining there
Sure.
and you like to store it there. That's what brought you in to begin with. I tell people it's not a license to eat Twinkie bars because your nose and ears aren't going to grow. The fat will go back to the muffin
Of course,
top because
of course.
that's where you store
Where it likes to live.
Yes, I frequently have patients who've had liposuction and they say, well, it worked for 3 years. Well, it would have
Okay.
worked the rest of your life. They sucked off 5 pounds and now you put on 5 pounds.
Do you take care of your skin on a daily basis? Do
Yes.
you cleanse and put creams on and do what the women do?
Yes, yeah,
You do?
yeah. I started a few years ago because I'm in the business primarily.
Right.
And for men, you have to keep it simple, just like our last speaker said, you know. And so sunscreen in the morning. Most men don't like creams on their face, so I like pressed minerals. There's various very good minerals out there that are
So you
zinc
just
and
dust it
titanium. Yeah,
on?
you just dust it on. Takes 5 seconds. You have an SPF 30 on your face for the whole day because the minerals reflect light. You don't have to reapply it.
Right.
And then at the end of the day, you wash your face and you put on vitamin A cream. That's nice and
And
simple.
that's it. And
That's
vitamin
it.
A is a good
yeah,
cream
vitamin
for
A is a
skin?
good cream. But you have to get a reputable company that puts the percentage of vitamin A on the tube. Because many companies will put in 1 molecule of vitamin
Right.
A, and it's an insignificant amount.
So read the label.
Yes, and it'll say the percentage.
And call Dr. Braun to
thank
see if that's enough, right?
Yes.
Enough vitamin A. Do you take tattoos off too?
Yes.
Because
Yes.
there's the odd
Another
drunk
growing
sailor,
industry.
you know,
Yes,
who has an I
exactly.
love mother in the wrong spot.
Exactly.
Thank you.
Thank you. Fanny.
Dr. Martin Braun, Vancouver Laser and Skin Care Center.